Thank you, darling. Cheers. Bye. Bye.
Let's see, time now is 7:20. Firefighters will be able to drive ambulances and deliver food and medicine to help support other emergency services. That's under a new agreement between firefighters and their bosses. The crews will take on these extra tasks alongside their duties like responding to fires and road accidents during the coronavirus outbreak. Let's find out a little more now. Speak to the General Secretary of the Fire Brigades Union, Matt Wrack. Morning to you, Matt. Thank you for your time this morning. Just give us a sense of how this will work in practice.
Well, this is a document that will be released later today, and it needs to then be discussed at local level. So it's a start of a process that we've been discussing over the past few days. But clearly the Fire and Rescue Service and other public agencies, local governments, are all considering how to respond to this pandemic, particularly in the light of the fact that staff numbers in public services are being already reduced with self-isolation and so on. So this is putting the NHS under great strain. It will is already putting the Fire and Rescue Service under some strain. So we've been approached by other agencies, and we've had discussions about areas where the Fire and Rescue Service may be able to assist and help, while at the same time obviously maintaining our core functions. So it is a huge challenge that we're facing, and we've been discussing, and that discussion now takes place at a local level, and it has to address issues like training and personal protective equipment, and the ability to maintain that core function of fire and rescue calls.
On the face of it, Matt, and obviously you know full well what your members are capable of doing. Presumably they've got skills that are transferable. I'm thinking, for example, about drivers. I know the suggestion that they could be driving ambulances, for example. I mean, they look like there would be transferable skills.
Yeah, clearly there may be transferable skills, but it has to be looked at. We can't have people doing things that they're not trained or competent or capable of doing. But yes, that's exactly the sort of issue that is going to be looked at, and there's a lot of work already underway, and I know that firefighters are already considering these things themselves. As I say, we're clear that this needs to be risk assessed, there needs to be training where appropriate, there needs to be a dialogue between different agencies, and it may vary across the country. We know that there are particular problems in London at the present time, but that is likely to spread. So there may be things that are needed in one part of the country that aren't needed elsewhere. So it's quite flexible, and it is a huge challenge. But I think this opens the next phase of that to ensure that we're prepared if as we expect, things get worse over the next few weeks.
And Matt, just on a slightly unconnected theme, I saw a lot of images of firefighters outside their stations last night at 8 o'clock joining those tributes to NHS and care workers. These are people who work alongside each other a lot, your members and those people who work in the caring professions. It was an important moment, wasn't it?
Absolutely, and we do work alongside colleagues in the National Health Service and the Ambulance Service very closely at lots of every day of our working lives. I was out in my street, and it was quite moving to see, and it's fantastic to see our members, firefighters across the country, joining that national celebration of our National Health Service. It was fantastic and very moving.
Matt Wrack, thank you very much. Matt is the General Secretary of the Fire Brigades Union, just talking to us about